My name is Natasha Tracy. Thanks so much for joining us this afternoon. My name is Natasha Tracy. As I said, I'm here for HealthyPlace. I'm a mental health writer and speaker, and today I'm hosting an information session about Spravato, a brand new depression drug that has been shown to treat those with treatment-resistant depression, possibly even in hours rather than in days or weeks. And I'm having my conversation today with Dr. Prakash Masand. Hi.
Hi, how are you?
Good. So just to be clear, HealthyPlace is doing this event because we feel that trusted information is needed on this subject. Many people who visit our site and communicate with us on social media have been asking us questions, and that's why we're doing this. We have not and are not receiving any money or remuneration of any type from anyone for this event, and we have not been contacted regarding this event by anyone, and this includes by the developer of this medication, which is Janssen Pharmaceuticals or Johnson & Johnson. So let's get down to it. Dr. Prakash Masand. He is a board-certified psychiatrist. He is the co-founder, chairman, and CEO of the Centers of Psychiatric Excellence, COPE, which provide management services to psychiatric ketamine treatment centers around the country. Dr. Masand is also the founder and CEO of Global Medical Education, a major provider of continuing psychiatric education courses to doctors and medical practitioners here in the U.S. Dr. Masand has been involved in dozens of psychiatric research studies throughout his career and has authored more than 400 peer-reviewed articles, reviews, abstracts, and book chapters. You can read more about his background at copepsychiatry.com. So, I've got lots of questions for you, Dr. Masand, but I know that our audience has lots of questions as well. So make sure you do leave your questions here on Instagram, and I'll make sure that they get asked during our conversation today. So good afternoon.
Good afternoon. Great to be with you and the rest of the crew at HealthyPlace.com.
Thank you. Can you give us some brief background information about Spravato, which is also known as esketamine?
Sure. As you know, Natasha, there are many unmet needs in the treatment of clinical or major depression, and there hasn't been an innovative treatment in the last 20 to 30 years. And so esketamine is a very recent addition to the medicines that are available for patients who do not benefit from what we traditionally refer to as the SSRIs and SNRIs, the Prozacs, the Paxils, the Zolofts, the Celexias, the Lexapros. When they do not work, what do you do next? And that's what esketamine has been approved for: treatment-resistant depression when you fail 2 trials of one of the classical traditional antidepressants.
So this drug is a relative of the drug ketamine, which we call Special K on the street. Can you tell us how these 2 drugs are similar and how they're different? I mean, is it the case that people are just getting high on this drug?
Sure. So intravenous ketamine, as most of your audience knows, is used for anesthesia and has been used since 1970, so almost 50 years. Today, if you go to the emergency room and you need a procedure, they will give you intravenous ketamine as an anesthetic. So it's very commonly used. There have been studies done for the last 10 to 15 years, including at the National Institutes of Mental Health, that found that intravenous ketamine in small doses, sub-anesthetic doses, 1/10 of the dose of anesthesia, is a very powerful antidepressant. Janssen developed the S enantiomer of the ketamine molecule and produced an intranasal formula, getting it intravenously. In a 40-minute infusion, you can actually take it intranasally. And so obviously the ease of administration is much better, and you can also make it available to more people because of the delivery method. In low doses, that ketamine is used to treat depression, and as long as patients follow their clinician's instructions, the rates of abuse are extremely low.
So what is its relationship to the street drug?
So this is just an S enantiomer. It's just kind of a cousin of sorts to ketamine.
Right, a cousin, okay.
It's like a cousin. It's like a second cousin
Okay.
of ketamine, the street drug.
And am I right in saying that when people use it recreationally, they tend to take very large doses of it? Is that correct?
That is absolutely correct, Natasha. Most people, when they abuse Special K, they use grams, 2 grams, 3 grams, 4 grams. When it's used for treating depression, the dose is, 84 milligrams, right? So it's a matter of excess.
So even if some people, for example, might find Special K on the street addictive, there's a lesser chance of addiction on this medication version. Is that correct?
In the doses that it's prescribed for the right patients for which it's prescribed, the risk of addiction is low. But if you take it for the wrong reasons, and we know this about opiates, or we know this about benzodiazepines, right? You can take Xanax for the wrong reasons. You can take opiates for the wrong reasons and get addicted to it without a doubt.
Thank you. Can you tell me who would be a candidate for Spravato and then who wouldn't be a candidate?
Sure. So it's FDA approved for treatment-resistant depression. You have to have failed 2 trials of an antidepressant at adequate doses for an adequate duration. And if you do not achieve remission with at least 2 antidepressants, then you're considered a candidate for Spravato. Patients who have not tried 2 antidepressants are not candidates for Spravato. Spravato is not a first-line antidepressant. So if you walk into your clinician's office and you say, oh, I've been feeling depressed, can I start on Spravato? No, that's not what the FDA has approved it for. You would still be started on, sertraline or fluoxetine or paroxetine, one of the generic antidepressants, and you've got to fail 2 of them before you're a candidate for Spravato.
And
Spravato also probably should not be used in people with a history of substance abuse, people who have elevated blood pressure until it's controlled. You have to make sure they don't have an aneurysm. So if you read the label of Spravato, the FDA has put certain contraindications in the label for patients who are not candidates for Spravato.
Great. And can you tell me anything about its use in bipolar depression? So for those who've been suffering depression as part of bipolar disorder.
Spravato was only studied initially for major depression. It's not been FDA approved for bipolar depression. So if you use it for bipolar depression, it would be considered an off-label use. Now, intravenous ketamine, which also is used to treat major depression, and for which there are several studies, there are studies of intravenous ketamine in bipolar depression. So one could make a reasonable argument that even though there are no studies of Spravato in bipolar depression, in the most treatment-resistant cases of bipolar depression, when you've tried drugs that should be tried first, drugs like Latuda or drugs like Abilify, drugs like Seroquel or Symbyax or Vraylar, the FDA-approved drugs for bipolar depression, and if they don't work, then off-label, you might consider something like ECT and you may consider something like Spravato, but it's not FDA approved for bipolar depression yet.
Okay. Can you tell me what it would be like if I were to walk into a clinic and what I would experience the day that I actually go and get Spravato?
Sure. So first and foremost, the clinics that are allowed to administer Spravato have to be certified. The clinician who's going to be administering the Spravato has to do a risk mitigation strategy. It's called REMS. And you have to go and do that training in order to prescribe Spravato. The other thing is that the clinic, which is certified to give Spravato, also has to have the ability to store Spravato because it's a Schedule 3 drug. And so it's double locked in terms of it. And you have to keep records for the DEA because it's a Schedule 3 drug. So make sure that you go to a center that's certified, that has done the REMS training, and that has the ability to store Spravato as per the DEA's requirements. And once you've chosen the correct certified center, you'll go in and you should get an evaluation by the clinician to make sure you're a candidate for Spravato. You have treatment-resistant depression, and you do not have any of the contraindications. And if that's the case, they can schedule you to start Spravato. And typically, you get 8 treatments in a month, in the first month. So 2 treatments a week for 4 weeks. And then after that, for 4 weeks, you get 1 treatment per week. And then after that, you can get it every other week or every week as required.
And so you said as required, right? So does that mean that people could take this drug for months or years?
So Janssen has data for up to 40 weeks looking at maintenance of Spravato in patients with treatment-resistant depression. And as your audience knows, major depression in many individuals is a recurrent illness. This is not like getting infection, you take an antibiotic and it goes away. It's a chronic illness. And as a general rule, the rule of thumb is every patient who has the first episode of major depression needs at least 1 year of maintenance treatment. After they're all better, after they're in remission, they need 1 year of maintenance treatment with whatever medicines help them. And if it's the second episode, 2 years, 3 or more episodes, lifelong. So depending upon where you are, is this your first episode, second episode, third, fourth, fifth episode, your maintenance treatment may vary.
Okay, great. So given everything we've talked about, given the fact that it can work quickly, given the fact that it can be very effective, given all these different facts, is it really the miracle wonder drug that we've been waiting for in depression treatment?
I never like to use the word miracle or wonder drug until you've used a drug and you have experience in thousands and tens of thousands of patients over the course of a year, 2 years, 3 years. But what I can say is this is a true innovation in treating depression. It works differently, it works quicker than the older drugs, and it works in patients in whom we know other treatments do not work. So this is a true advance in the treatment of depression. And the other thing is the drug is also being studied for acutely suicidal patients. And there is evidence to suggest that if you have suicidal ideation and suicidal thoughts, a drug like Spravato can decrease or even eliminate the suicidal thoughts in a very short period of time with treatment. And the drug is actually being studied in suicidal patients independent of diagnosis, not just depressed suicidal patients, but suicidal patients independent of diagnosis. So that's another big advance because as you know and your audience knows, there are no anti-suicidal drugs currently available, even though clozapine and lithium decrease suicidalities only over a long period of time. It's not acutely. So that's another advance. So I think this is a true innovation. It's going to be of great benefit to many, many patients. And I think it's nice to have more options, as we know, because many patients do not benefit from the available treatments.
Unfortunately, we have run out of time. I just want to thank you, Dr. Masand, so much for taking some time to talk to us. I do think this sounds like an amazing innovation, just like you said. So I really hope that people have listened to you today and can take away some hope from this conversation. Thank you so much.
Thanks so much, Natasha. Great being with you and your audience. Thank you.
Bye-bye.
Bye.